Everybody, it's Dr. Seiler from Seiler Skin, and I've got Kayla, one of my estheticians, with me today. And so we're going to show how a little bit of filler goes a long way in a younger patient. We've done a little bit of filler in her in the past, but she was mentioning to me the other day what she kind of sees in her face. So I'll turn it over to her to kind of tell the camera what you were telling me yesterday.
So basically, I'm assisting with filler all the time, and I see what filler can do for a patient, so even a younger patient that sees just a slight little change. And I've just kind of noticed a flattening of my cheek right here, especially at an angle. I'm seeing a little spot right here that's kind of poking out more, so I think I'm just losing a little bit of volume. And when you lift up just a little here, it also affects my lower face, so it's just really where I'm noticing some droopiness. So we're going to do some filler at the cheek today.
All right, so she pointed out to me that she needed a little, and she's correct. I think for those of you watching that might be injectors, it's also important to notice that you have to really look at what the cause of the issue is. So lots of times you can incorrectly just inject around the mouth when that's what the patient's concern is, but where the volume loss is coming is from her cheek, which you can see that even if we just give her a little bit of a lift, that makes a nice correction around her mouth. I think the other take home is, both for patients and practitioners, is that Kayla on first look does not look like somebody that might need filler in her cheeks, because she's got pretty good full cheeks to begin with, but she's very smart, and she was correct in noticing that she's lost just a little bit of volume through here and just a little bit of volume through there. So even though she's got pretty full cheeks to begin with, I know how to put just tiny little bits of filler in the right areas to give her a nice lift and kind of create that full cheek right there without making her look cheeky or round or fat. And it actually will give her a nice angle to her cheek, not only lift her, but make her face look even slimmer. So we're going to get started with our first little injection here. We've already iced the skin and alcoholed, so we're nice and clean. Chelsea, my lovely assistant, who's also an esthetician, all right, good, has shown me where the little bitty blood vessels are. That's that little AccuVein device that we use to help me avoid the vessels, not only so I don't injure them, but so we don't bruise her. I'm going to aspirate a little bit here because I'm deep. Then I'm going to do just a little bitty injection. And Kayla's correct. She really is right where she needed filler. And she's not had any anesthesia. We haven't done any numbing cream, no numbing shot. And she tolerates this just fine. Most people tolerate their cheek without anything but just a little bit of ice. You're doing okay? Mm-hmm. Inject a little bit as I go out so we can kind of put that cheek up. And you can see just that one little injection. I only used about 1/10 of a syringe there. Makes that nice and kind of lifted and full. And now we're going to inject just a little bit around her mouth. We could have stopped with just the one filler in the cheeks, but Kayla mentioned to me that she's always been a little asymmetric in this area. She smiles a little bit harder on this side, and this is also her sleep side. So she has lost just a little bit of volume around the mouth and what we call the nasolabial fold. And even though we really corrected this nicely with the cheek filler, and her cheeks look much better, they're much more lifted, and this is much softer. Since we've done this before in her, we're going to put just a little bit of Juvederm around her mouth. She wanted to go the extra mile and make sure we get everything done. So you can see, again, we're doing this without any anesthesia. She's tolerating it fine. A little bitty prick when we start, but nothing intolerable. And our little vessel viewer there is keeping me from hitting anything. And you can see from her cheeks, we just finished her cheeks 2 minutes ago, so we haven't delayed this footage. You can see that her cheeks aren't bruised or bleeding at all. She always blushes a little bit, so her cheeks are a little red. She's a little rosy, but she won't have any bruising in her cheek at all. So the other thing that we can do too is, let's ice down here just a little bit. She's got a pretty good length to her jawline and chin, but her chin's just a little short, so even though she's young, she's noticed that she's just barely starting to kind of see a little bit of a dip in fullness right here. All right, great. So what I can do is put a small little kind of deep aliquot of filler right here. You can see I do my little wiggle here, and usually they barely even feel it. I aspirate here to make sure we're not in a blood vessel. And I'm going to do a little bitty injection here. And in the cheeks I used VOLUMA, which is really good for deep filling. Juvederm can go multiple different depths, so we're using Juvederm here, and Juvederm will expand nicely, so I only have to put a little bit in right there, and that will correct that. Let's look. All right, so we've finished our filler treatment of Miss Kayla here. So we've used 1 syringe of VOLUMA total between both cheeks, and we've used about 75% of a Juvederm syringe. We've got a little bit left over for a touch-up if we need it to kind of correct this area. You can see that even though she's pretty vascular, She doesn't have any sign of bruising. We had one tiny little spot that bled that we held pressure on, and that stopped, so she shouldn't have any bruising afterwards. She tolerated great without any anesthesia. We've lifted up her cheeks really nice. It might be a little hard for you to pick this up on camera, but we're going to take pictures immediately afterward, and then we'll take them again in a month, which is really the peak of the filler once it really expands and lifts and thickens the tissue. So I just wanted to kind of show that not only does she look great and better, but she doesn't have any sign of bruising. Should be able to go back to normal activities and enjoy her results. So thanks for watching.